So just as a brief introduction to guidelines and their importance. These are my disclosures. So I think we need to take a step back and first talk a little about what is evidence-based medicine. And essentially it's defined as the conscientious, explicit, and judicious use of current best evidence to help us make decisions about the care of our patients. What it means is integrating the clinical expertise with the best available clinical evidence from systematic research, as well as patient understanding and values. So there's three elements that go into evidence-based medicine, which I think most of us do not fully understand. It's not just evidence, it's clinical judgment, as well as patient preferences and values. All these are taken into consideration, and where the intersection of those with the evidence comes together, that's what, when we talk about evidence-based medicine. And guidelines are essentially systematically developed statements to assist us, clinicians in this particular situation, as well as patient decisions about the best care decisions they can make or for specific clinical circumstances. And the guidelines are essentially, they provide the framework for evidence-based medicine. So when we create guidelines, we incorporate all those three aspects of the clinical experience, the research evidence, as well as what patients' values and needs are or wants. So why do we need them? Because we do all have the desire to offer the best possible care, right? Number one. Second, because there's a lot of variation, in the delivery of healthcare that is currently occurring in a variety of hospitals and situations. And because the rising healthcare costs, often related to that variation in the delivery of care, are definitely a concern. So if we want to do a reality check, the evidence suggests that actually we don't necessarily routinely practice evidence-based medicine. So there's a number of, as you can see from this paper, the percentages are not really near 100%, right? So meaning how often the appropriate evidence-based medicine intervention was provided for this type of conditions by physicians. So what does that lead to? What it leads to is that oftentimes we have deficiencies in the delivery of surgery care or acute care, chronic care, in a variety of areas as highlighted here. And that's where the importance of guidelines come in. So the rationale is that us as clinicians, policymakers, and payers, we see guidelines as a tool that can make the delivery of care more consistent, efficient, and for closing the gap between what we want, what we do, and what we should be doing based on scientific evidence. So there's specific benefits of guidelines to us as physicians. They can improve the quality of clinical decisions. They call attention to ineffective practices or sometimes even dangerous practices and wasteful practices. They support quality improvement activities like development of care pathways, oftentimes the result of guideline work, standing orders or treatment algorithms that we typically produce when we develop guidelines. But another very important aspect of guideline development is also, as part of the process, we identify gaps in the evidence and the research that needs to be done to inform better future guidelines and better decision-making. They can offer medical legal protection, and they do prompt, especially when they're well done, government as well as payers to provide coverage for specific things we do that may be new and we may not have coverage as of yet. But there can be also harms that are introduced by guidelines. And so if the guidelines are flawed, they can harm practitioners by essentially providing them with inaccurate scientific information and advice, and that can compromise patient care. A negative or neutral recommendation may prompt providers to withdraw their availability to do this or cover that particular recommendation, whatever that applies to. And auditors or managers may unfairly judge the quality of care based on criteria of invalid guidelines or guidelines that don't necessarily comprehensively address the issues at hand. And they can also be used in malpractice litigation against you if you did not follow them, and if you did the right thing and the guidelines were wrong. So that can happen too, which is why it's so important to have good quality guidelines. And there are benefits for patients as well as harms. I'm not going to go into, and for healthcare systems, I'm not going to go into details. I just wanted to finish. It was a brief introduction to guidelines because this session will be about guidelines and talk a little about the take-home points. So evidence-based medicine is defined by three equally important dimensions, right? As we discussed, scientific evidence, integration, clinician experience, as well as patient preferences. So all these three things are taken into consideration. It's not just one or the other, they're all equally important. The guidelines provide the framework for evidence-based medicine and play an important role in the delivery of healthcare. And guidelines are associated with significant potential benefits when developed rigorously, but can also lead to harm if the quality is poor. And this is one of the main reasons why over the last several years, SAGES and its guidelines committee has put a lot of effort in really producing the most robust guidelines that can be produced to minimize this risk. Thank you.